Welcome to Physicians Who Lead, the podcast where we sit down with physician leaders who are shaping the future of healthcare. Each episode, we dive into the real challenges facing our system today and hear directly from the physicians leading the way with innovation, resilience, and vision. If you want to understand how healthcare is changing and meet the leaders driving that change, you're in the right place.
Welcome back to the Physicians Who Lead, the podcast where we talk about physicians who are shaping healthcare through leadership, service, mentorship, and the way they support the people around them. I'm your host, Kevin Kirkpatrick. Today, I'm joined by Dr. Shawn Andrews, a family physician and physicians leader whose story includes a transition that many physicians think about, may not talk about openly, moving from self-employed practice into an employed physician role. For many physicians, self-employment represents independence, ownership, flexibility, and a deep connection to patients and community. At the same time, it also means carrying the full weight of a business, staffing, operations, finances, and decision-making. What I'm about to explore today is how Dr. Andrews made that transition, how employing helped her thrive, and what role coaching, mentorships, and the lessons from her chief medical officer played in that process. Welcome to the podcast.
Thank you. It's good to talk with you.
Excellent. So I got a few questions that I'll ask, and we'll run through it and try and be as casual as we can. But to start, can you tell us a bit about your path into medicine and the kind of practice you built over the years?
So I grew up in very, very rural Western Washington in a town called Cathlamet in a county of 3,200 people. I had a family doctor and never went to the emergency department. Always saw my family doctor, called them if I had an injury or an illness on the weekend, and they would meet me in the office. And it was an interesting growing up period. I didn't have any family members who were physicians, so I went to medical school fully anticipating to be a family physician, not actually realizing that residency would be required after medical school. Really didn't know very much when I started. Except that I wanted to be a family doctor in rural America, preferably Washington. And so finished high school, went to college, went to medical school pretty directly, worked as a CNA for a summer in between there, and then started medical school right out of college when I was 21. Started residency right out of medical school, of course, when I was 25, and had a lot to learn about what is residency and what does healthcare look like and what are the things besides being a physician and a community member. So I have worked in Alma for 29 years. Actually, I was employed initially, and it was in the time when big hospital systems were not particularly great at managing rural family medicine practices. And the company that I was working for divested, and I was left with the choice of closing the practice or going into private practice. So that was my launch into private practice, actually. Shortly thereafter, my business partner decided they needed to move back to the Midwest. So I was a brand new doctor with a 2 to 3 provider practice and very little experience running my own business. And I believe I was about 30 with 6 employees and now 2 little kids and a solo private practice. That was interesting and hard, and I didn't get paid for several months, but I kept all of my staff, and we hired a few other docs fresh out of residency and had a pretty nice run in a private practice. Although we didn't make a lot of money, we did a lot of good medical care and built some things that I'm still pretty proud of. And then one of them decided they needed to move on right after we had built a new building, and the other one, unfortunately, while we were in the process of transitioning, the other one died. So I was left in solo private practice again. And so the decision to transition into another employed practice was a pretty quick one. And I had some concerns because of how things had gone previously in private practice. And I might have previously said to myself, I will never do that again. So I had to bite my tongue and listen to some people who cared about me, who said, this might be a good option for you. I think you should think about it.
Yeah. Was there parts of the self-employment and stuff that you valued?
Of course, the independence, the ability to make the decisions that you're responsible for. Like if the bills are responsible for getting paid, I get to make the decisions on what we actually offer, what expenses we actually incur for the most part. and how the practice goes. And I could make things happen really quickly. If I needed us to pivot, I would make a decision and we would pivot now. And that was really great. And then I could decide my schedule. I could choose to work 7 to 3, seeing patients without a break, and then still be able to pick up my kids at school if I wanted to do that. I could decide whether my schedule was double booked ever. I could decide what the benefits were going to be for myself and the staff. Of course, then I had to pay for that, but I could make all of those decisions. And that was pretty, you lead by influence, but because you're the one who signs the paychecks, there's not any pushback or confusion about who's doing the leading.
Yes. Now, you did mention a few life instances, like someone relocating and someone dying. So I don't think there's a workforce planning aspect for someone dying.
No.
Nor can you ask them to reconsider their decision. But kind of what led to moving to the employed model? Was it something that kind of happened gradually, or was there like a moment where you're like, okay, I'm done, right?
So yes. So I had recruited a friend of mine to work for the hospital district where I am now employed, but was not employed at the time. And he called me and said, I want you to think about being employed. And I started giving him all the reasons why that was a bad idea. And he said, could you just hear me out? And so I literally bit my lip, and he explain to me what the benefits might be and why that might be good for me. And I had some clarity that I really couldn't be in sole private practice. And again, it's really hard. It's great, but it's also really hard. And I had 2 little kids and a relatively long commute. And so it was actually a pretty quick decision. And the benefits were, hey, you can still see your patients. We'll make sure that you have the staff you need. We'll make sure that your staff is paid, and you'll have health insurance, which was great. And you could think about retirement and start funding your retirement. And these are all the things. And you're in the same community, and we'll lease your building. And I mean, those are some pretty reasonable considerations.
Yeah. Were there any concerns that you had before making the decision to make the transition?
Well, I mentioned briefly that the employer I had before had divested, and they hadn't done a good job of sending out our billing, and it was just really difficult. And I was fearful about that. But my new employer was smaller and local, and I already had privileges with their hospital. I was already doing admissions for them on their inpatient unit. And so it was more of a known quantity, and I was more of a known quantity, I think. So there was already relationship, which was helpful. And it was smaller and more personal, which I think for me is important. Growing up in a very small town, it's important to have relationships and know the team and be an individual, not just like a cog over there seeing patients generating revenue that nobody really knows about. It's me, and I'm a person, and I exist as an individual in the organization.
Yeah. What once you made the move, what changed for you in a positive way?
Well, the very obvious thing first, right out of the gate, was a reliable stream of income, which it's very hard to make that happen in private practice. If you see Medicare and Medicaid and you aren't able to access any of the enhanced forms of reimbursement that are available, the administrative burden for those programs is significant for a solo private practice. So I would say that my take-home pay probably doubled.
Well,
Yeah, it was dramatic. And I had health insurance and other like medical, dental, vision, and I could start paying into retirement and planning for my future that way. And I was no longer responsible for the billing and the collections and the hiring and and firing of staff. I also didn't get to decide what electronic medical record we used, right? I didn't get to decide if we went to a medical record from the paper charts I was currently using. But there was a whole lot of stability right out of the gate in terms of just financially. It was a huge sigh of relief for me.
yeah. One of the harder parts of a transition like this can be identity. When you're self-employed, there's a sense of ownership and control. Was there anything you had to let go into this change?
I had to work hard to learn to be employed, and it was not a quick transition for me. I am a little stubborn. I'm a little independent. I might be a little controlling at times. And so I think the biggest frustration was not realizing that decisions would take time and I knew I wouldn't get to make them all, but I didn't realize that they would take so much time and that there might be differences in how I saw a situation versus how my employer saw a situation. I might see something as being urgent or needing immediate attention, and it might take weeks. That was hard. I might make a decision that would have been fine if I was in private practice, but I wasn't. And so there were a couple of times that I had to be reminded where the boundaries were. It's just a very different learning to be employed once you've been in private practice for some of us, especially if we were the responsible, shouldering the burden, making the decisions, and being able to make them quickly, realizing that you're sort of back a step and you have less responsibility in terms of the finances, but you also have less overt authority. You have to learn to lead by influence instead of by position, if that makes sense.
Yeah, no, it makes a lot of sense. In that stream, one of the things when we talked the first time, you talked about coaching and stuff like that, and that you've used a coach. What made you decide to work with a coach?
Well, I was probably 5 years into being employed and quite honestly didn't realize how frustrated I was with not being able to make some of the decisions, didn't realize the impact I was having on folks. I was trying to drive what in my mind was excellence, and it was taking longer than I wanted it to. And so I started to try to be I got a little blustery, you might say. People started to hear the cadence of my footsteps and they would avoid me because they knew I was coming to say, this isn't right. I need it to be fixed. I need it to be fixed now. And I quite honestly made a lot of errors in my nonverbal communication. My intentions were good, but my impact was not so good. And I received some really painful feedback about that. That was really rough. I felt that there were some really unsafe things happening, and I felt personally responsible to fix them, kind of like I was still in private practice, but because I was the physician, and they were things related to patient care. And wasn't able to make them happen with the tools I was used to using. And so I got louder. And so actually it was in a time of distress and not being able to have the impact I wanted to have and having some really negative impact that I didn't want to have, that I decided it was time to engage a coach. And it was a rough, I engaged a coach, an executive coach for a year plus,
Right.
And had to take some really honest feedback from folks I'd known for a long time that had previously worked for me about the impact I was having. And I think the thing that landed the hardest was, well, we know you don't mean it.
Right.
That was tough. So I learned to do some things differently to have the impact I wanted to have. And part of that was learning to be quiet and listen and not say anything difficult unless I had time to sit down and make eye contact and have a conversation about it. And it was a great choice, but birthed out of a very painful situation personally and professionally.
Yeah. And I think what happens is that in the last year and a bit that I've done this podcast, what people don't always realize is the transition from autonomous clinician to, part of a larger organization. And I see it in multiple ways. And I'm going to change stream a little bit with you and talk a bit more about the leadership work that you've done as well, because I think that's also a transition where you're moving away from, being the controller of the time schedule because you're the one providing the clinical expertise to, moving into leadership. So, it looks like, after this time frame, you moved into a medical director role and moved into leadership. Was leadership something that you envisioned for yourself, or was it kind of, hey, this is my best way to make changes?
The transition into a formal leadership role actually happened through the coaching relationship in terms of, it was a transition spot for me, sort of from the first half of my career to the second half of my career. And after moving past what impact was I having that I didn't want to have, we got to move to what's the impact I want to have for the last half of my career? How do I leave behind something that's bigger than me, that has a life without me after I'm gone? And leadership is one of those ways, particularly when you have the opportunity to build in a rural community. So my entire career has been rural. I understand rural. I grew up rural. Not that every rural community is the same, they're not, but there are some common threads. And for me, I'm passionate about people in rural communities having great access to really high quality medical care. And how do you build something that outlasts you where that will perpetually happen? And for us, that included expanding primary care because it was necessary and it continues to be necessary, and we're not done yet. Offering service lines locally that are necessary for folks that they're suffering without, that they're not really practically able to access when they're required to travel outside the community, excuse me. And then building a family medicine residency, because you have to, if you're rural, people aren't always going to run to work in a rural community just because it's there and the pay's fine, right? They're passionate about it, or they have learned about it and they're comfortable there and they've grown up there as a professional. So those kinds of opportunities to develop service lines and programs that will ensure that there's great care long after I'm retired is really special. And that's what drew me to leadership. That and helping other physicians and providers make the transition, maybe from private practice or even from school, into a culture that you continue to build, and you build positive culture on your care team because you spend a lot of time with the people you work with. And one of the things that makes you love getting up and coming to work is loving the people that you work with.
Yeah. And it's interesting because I've seen a lot of a lot of communities, build family medicine residency programs and then see the lifeline of new physicians, because people come in, a family medicine residency is 3 years, so they spend 3 years somewhere, and like you say, if the culture is good, the retention of those learners usually goes up, and thereby gives you a great great pool of candidates. Is there somebody that's been a great mentor to you as you transitioned through this process?
My CMO has been so helpful. And I think the most impactful thing, maybe, especially early on, was he said to me repeatedly, because I am a naturally sort of a little bit of a self-righteous, play by the rules firstborn. He said, proceed until apprehended. He would give me something to work on and then say, proceed until apprehended. And you don't believe that at first, but he really meant it. And he is an outside the box thinker and extremely innovative, and he sees the problem as an opportunity to have a solution. Like he does not believe in insurmountable barriers. It's really that's been super fun because he's very different from me in that way, and I have learned a ton from him. So that opportunity to try things and go and then have a safety net, and he has gradually withdrawn the safety net over time. Like it's still there, but he allows me more autonomy and gives me more responsibility, particularly with managing the primary care team and hiring the right folks and building the culture, and looking at clinically how can we improve, and making me responsible for how do we improve access, how do we improve retention, those kinds of things. And so that's been a real gift in terms of evolving in as a leader in healthcare.
Yeah, because it's interesting. Like a lot of the leaders that I've talked to, it's mission driven and not title or financial driven, right? So it's really and I like you mentioned it earlier about leaving a legacy, and I think that a lot of physician leaders do it for that reason. And I think that supporting physicians in leadership is key because it allows them to be successful, allows them to build in areas that might not have been something they learned in medical school or residency and stuff like that as well, right? So it's definitely a reason that I put coaching in all my placements, is because it helps you manage self and figure out how we show up to work, right?
Exactly.
So excellent. Well, listen, I appreciate you taking the time to talk to me today. I appreciate you letting me pivot near the end here. I wanted to touch base on your leadership as well as the transition from public to or from private to employed. The last thing I will ask is if somebody's interested in moving into a leadership role, what advice would you give them?
I would say, what's your why? Why are you interested in doing this? There are a lot of good reasons to lead. Be prepared to speak several languages. You're already good at speaking provider, physician. You also need to learn to speak operations and finance and administrative language. And I would say, for me at least, the connecting people that might have strained relationships, finding the common ground is really, really important. It can be a little bit lonely because people that have been your peers might now report to you. You still have relationships, they shift. And so find your support, whether that's a coach or a colleague in another institution or another leader. You will need your people to talk to. There will be things that you can't always talk to your peers about. So that's what I would say. What's your why? Make sure it's the right why, and then build your support.
Excellent. Well, listen, thank you very much for taking the time. And I appreciate you answering my questions and sharing your knowledge.
Thanks. You have a great day. It was good to talk with you.
Thanks.